Okay, hello Aunt Charlene.
Hey, how are you?
Now, you received a heart transplant, did you not?
I did in 87.
87. That's astonishing, really. Did you know that there's only there's an 80% for survival chance for 2 years after your transplant, and there's only a 56% for 10 years after. It just gets really low. Most people don't survive after 20 years.
Yeah, they told me 10 years still on my transplant.
So that was like 30 years ago.
It's been 26 years.
Okay. Can you tell us a bit about the person who donated the heart to you? Do you know anything about him?
The only thing they told me was he was a 24-year-old male from Orlando, Florida. Back then, they didn't really let you know much. He was in a car wreck.
It's actually, they can't donate the heart unless someone's died,
Yeah.
So it's kind of sad. Can you tell us a bit about the surgery?
I know it took, I'm thinking it was like 8 hours that the surgery took. And of course I was on call for, let's see, let me think. In April they told me I would have to have the heart or I would have 6 months to a year to live. So they put me on a waiting list, and I got my heart in March of the following year. I done really good. I've had moderate rejection when I first got it, which was fairly normal, but after that I've had no rejection.
Have you had to adjust to a certain diet and exercise routine?
I have. We're on low sodium, low salt, low fat, and then which as far as exercise, I hadn't really ever been on a routine. Pretty much done what I want to do. So I was pretty fortunate with that. Supposed to have been on one, but I haven't been.
They say the nerves are cut during the surgery, so you can't really feel your heart.
That's what they've always told me, but I've had 2 heart attacks with this heart, and it had been 10 years out, and I did feel it.
It hurt?
Yeah.
Okay.
I did feel it.
Is there anything else? How many medications do you have to take?
I take, I'm on 3 rejection medications, and then the rest of it's pretty much just medication from having to take the medication, like stomach, because it's hard on your stomach and stuff like that.
Do you have to take any immunization?
I do. I'm on cyclosporin, Imuran, and prednisone, and Rapamune. That's, for rejection medicines I take.
Can you tell me anything about what you had to do after the surgery?
Right after the surgery, which I'm kind of where I live from Birmingham, it was done at UAB, and Dr. James Kirkland is one done it. I had to stay up there from March the 23rd until May the 28th is when I got to come home. Because I lived so far out, they wouldn't let me come home for 6 weeks after.
Okay, well, that pretty much wraps all my questions.
Okay.
Thank you so much for doing this.
You're welcome.
Anything else you'd like to say?
No, I'm just blessed to be here.
All right. Thank you so much.
You're welcome.